heading to Galway with the wonderful Dr. Dilis Clare, a GP and medical herbalist, joins us, filling in once again for our own Annalise, who's on a well-deserved break. Good afternoon to you, Dr. Dilis.
Hi, Patricia. How are you?
I'm very well, and it was great once again to talk to you again. Now, as we said last week, because we got some calls in about the menopause, we said we would ask Dr. Dilis to start this week by discussing the menopause. So I suppose let's start before the menopause, at the peri-menopause. What would you recommend to people who have the symptoms and who feel and know that they are perimenopausal?
What I would suggest is all of the things that Annalise has been talking about, the exercise, movement, the sunshine on your eyes, even through the clouds for 5 minutes at the beginning of the day, taking vitamin D, B complex if you're under stress, and it's a time to reevaluate your life. The menopause is a process of change. It in itself is a transition. The perimenopause is preparing for the transition. So particular attention to eating a healthy diet and keeping the gut microflora well balanced, and eating fibre. Fibre escorts all of the breakdown products of hormone balance, escorts them out back into the environment where they belong through the poo.
Yeah. So fibre is really important.
It's massive.
And the thing with somebody, being perimenopausal, there's no science there to say what age it can happen to you at, and it can happen to women at all different ages.
The average age, like the accepted usual transition, is between the ages of 45 and 55, just by medical definition.
Okay.
Hormone tests are of very little value because it's the relative proportions of all of these things. But in all of the hype about the menopause, let me just comment that 1/3 of women have no problems at the menopause, and they're not phoning the radio, and they're not going into Annalise, and nobody is talking. They're not talking about it. 1/3 of women have mild to moderate problems or issues, and 1/3 of women have severe problems. And there's this whole debate about HRT or taking natural. To me, they're both appropriate for appropriate care. But the vast majority of women with mild to moderate problems will be helped by natural medicines. And the third that have severe problems are helped by using natural medicines, possibly in conjunction with HRT, but for a shorter period of time.
Okay. And
my biggest issue with HRT is there always was a very small connection with breast cancer. It was always very small. And for about 10 years, it was exaggerated. And during those 10 years, I think I was the only doctor that anybody could find that would actually prescribe HRT. And now it's like HRT is the answer to everything. But there's never any one simple way of going about things. And my concern, nobody is expressing my concern, which is that 1 in 10 or 11 women in Ireland get breast cancer. If you've been on HRT for 5 years, right, and it does take that long to influence a very small risk of breast cancer. But I don't want women to be unnecessarily in the position of thinking, oh, maybe I shouldn't have done that. Maybe I've contributed to my own whatever. And that's not an issue that I've heard raised. So thank you for giving me the opportunity for it.
It's a great point. It is a really great point.
In any case, the change is not an illness. It's not a hormone deficiency. And estrogen is a funny duck, like nearly all transmitters and communicators, cell-to-cell communicators. It has its very positive side, antioxidant and balancing and all the rest of it, but it also has different effects on different cells and different tissues. So it's not as straightforward. Estrogen isn't always the good guy. So it's the balance of the hormones. And that's why I'm saying fibre. It's the first thing to fix. Fibre and vitamin D.
Okay. All right. Now, a couple of people are on about sleeping problems with the menopause, including somebody to say I'm postmenopausal, but I've got terrible sleep problems ever since the menopause. Are there any supplements that Dr. Dilis would recommend?
Well, all the tryptophan-rich foods, including pumpkin seeds, and I think it's bananas are the other ones, but not too many bananas. The main things is to follow all the sleep hygiene rules, which are go to bed at the same time, even temperature, blackout blinds in the summer, and you do that for a period of three months to re-establish your normal pattern. Anxiety, a lot of sleeping problems is tied up with the heightened anxiety. I know I certainly felt that. Like where previously I was happy to arrive an hour and a half before a plane. Nothing would do me but to be sitting in the airport for 3 hours. That was the kind of the most tangible thing, but just more of a readiness to be anxious, where previously things would have sailed past me. So dealing with anxiety. There's lots of herbs. We have a relaxed blend down at Annalise's, which has valerian, lavender, lemon balm. It'll have a whole lot of herbal blends, chamomile tea. Now, this is the thing with herbal medicines. If you want to use herbal medicines or any natural supplements, what you want to do is to use them throughout the day so that you don't get into a state of sleep resistance. So you take your herbs in the morning, you take them at lunchtime, and you take them about an hour before you go to bed, so that you're primed for sleep rather than resistance to sleep by keeping calmer during the day.
Yeah, because that busy brain, it's to calm down all of that busy brain. Yeah. Now, staying on
and then you use the herbs for at least 6 weeks.
Okay.
For insomnia. Yeah.
Okay, and then staying on menopause, vaginal dryness is something that we often get questions in here for Annalise. And it's one of those issues, I think, that a lot of women don't talk about. Firstly, how common is it?
Vaginal dryness, I mean, comparatively speaking to one's fertile years, vaginal dryness is very common because you're no longer producing the hormones to prepare for pregnancy. So it's part of post-menopause is a different organic terrain state of being, all right, okay, which has a lot of advantages. I look back on my days of periods and go, dear God, how on earth did I manage? It's like living in a roller coaster. And I know that I'm not alone, and many people are writing about it, but it doesn't seem to be being picked up by a kind of a general consensus, which is that life is much calmer. You're not having those roller coasters. You're also not having premenstrual syndrome, premenstrual depression, endometriosis, polycystic. There's lots of things that are solved. Migraine is much better after the menopause. Menopause has a terrible rap with media.
Davina McCall has a lot to answer for.
Well, so if anybody is having a lot of problems with vaginal dryness, one of the big tips that my patients gave me is to use aloe vera gel instead of some of the very commercial lubricants. Okay. And it's a lot less expensive. And you don't have to tell your grandchildren what it's for if they find it in your bedside locker. Very important, these things in life.
Absolutely. Absolutely.
Annalise will have a vaginal dryness cream, which also has some essential oils that are good for sensitive areas. And again, the biggest tip is after the menopause, everywhere gets dry, not just your little bits. So what you want to do is moisturize them the same way you moisturize everything else, twice a day. Put the moisturizer on, okay, and you use one with no chemicals, things that are for sensitive skin. But Annalise will have one that's specifically designed for down there.
Okay, this is Carmel. This is a question directly in for you, Dr. Clare. She wants to know if the Dr. Clare Mucotone will be available again in Nature's Hand in Castle Troy in Limerick. It hasn't been there for ages. She'd heard the recommendation here on the programme for coughs, and she found it really good. Yeah. She also wants to know, is it okay to take for a long period of time? She suffers from a chronic cough. Has it other health benefits?
There's no, they're all registered as food supplements, so they're all in the line of foods. But I think the Mucotone is something that we use for an infection. And if you have a chronic cough, hopefully she's got it checked out by her GP. It could be a postnasal drip, which the congestion blend would be more relevant to. It could be medication that she's on. There are lots of other things that can cause a chronic cough. If the doctor has checked it out for her, I would suggest a herbal consultation. And we'll check with Castletroy whether they need to order it from us.
Yeah.
So did she have a chat with the
pharmacist?
People,
the person there, and find out. Okay, stay on the postnatal drip, because Anya has a postnatal went to Annalise for a postnatal drip about a year ago. She also has a cough, snoring, and a very sore throat constantly. And Annalise recommended Dr. Dilis Clare decongestant. But the nasal drip is still there. She's causing other symptoms and she's at her wit's end. Anything else for the nasal drip?
Certainly I would go dairy-free and wheat-free for 6 weeks. Then introduce one of them, see whether it makes any difference over 2 or 3 weeks, and then reintroduce the other. I find that dairy and wheat, for some reason, are a very common cause of the postnasal drip. If not, you'll need to make an appointment, because there's a whole, I think of my job as being like Miss Marple. You're going into all of the different areas and weighing up what might be, relatively speaking, having more or less of an effect or an influence, and it'll go back to family history, childhood history. We take all of those things into account.
Okay.
We do online consultations as well.
Okay.
Can I just go back to the vaginal dryness?
You can, sorry.
If it's persistent and it doesn't respond to some of the herbs, black cohosh has research showing that it is also helpful. But if not, there's a big difference between taking HRT, estrogen, pessaries. Very, very little is absorbed into the bloodstream. So there's a huge difference between taking the pessaries for that particular problem. And you don't need to go on HRT if that's your main problem.
Okay. Now, Dr. Dilis, question please. My 14-year-old daughter, on top of suffering from very bad anxiety, suffers from really bad PMS. She gets very strong headaches, migraines and nausea. How can I help her? It's gone so bad. She's ending up missing a lot of school from it all.
Okay. She probably needs an appointment if she's missing a lot of school. But the things that I would go back to is diet, digestion, massive connection between essential fatty acids, the gut microflora, and the actual nutrients. I find that it's a good number of patients that I see during their teenage years, it's actually because they're fussy eaters, or have specific concerns about foods or texture of foods. So I would always start with that. But if she's missing a lot of school and the medical route it has very little to offer with that, I would make an appointment for consultation. All
right, listen, we leave it there as always. It's been a real pleasure, Dilis. Thank you for that, and thanks for joining us.
No worries, Patricia. Lovely to talk to you.
Bye. We will no doubt speak again. That is Dr. Dilis Clare, who is a doctor and medical herbalist based in Galway.